Is Jenna Keller, and I'm super excited to be here with you guys tonight to talk about mindful meditation interventions and how they affect emotional regulation in children. Here's an outline of what we're going to be covering tonight. We're going to be doing a quick introduction, talking about the mechanism, interventions that have been studied, how it can be translated into practice, and then we're going to do a fun demonstration, and then I also have a case study and a conclusion. So John Kabat-Zinn is known as the modern founder of mindfulness, and he defines mindfulness as a philosophy that's grounded in Eastern spirituality, and it's the awareness that arises from paying attention on purpose in the present moment, non-judgmentally. So the main type of meditation that we're going to be talking about is focusing on building awareness and lessening the judgment. There's three main elements of mindfulness meditation. First, we want to look at disposition or attitude. So we want to be open, curious, kind, and accepting. Meditation also focuses in on attention, so being present in the moment and noticing important things around us. Finally, we also want to think about our intention. So during mindfulness, we want to ask ourselves questions like, why am I doing this? What's the importance of what I'm doing? Mindfulness can be implemented by a variety of professionals. It's mostly thought of as a psychological treatment, and it is considered to be in the third wave of psychological interventions, but it can be used in a variety of settings across the medical field and beyond in places like education and community practice. I have three different examples just to kind of introduce you to mindfulness. Here on the left, I have a little graphic for a body scan. In the middle, I have a graphic for examples of how to eat more mindfully. And then on the right, I have a cool example of a coloring sheet that also has a breathing exercise. So like I said before, mindfulness is considered to be in the third wave of psychological intervention theory. And in occupational therapy, the two main mindfulness theories that make their way into our interventions are mindfulness-based stress reduction and mindfulness-based cognitive behavior therapy. Dialectical behavioral therapy and acceptance and commitment therapy are more commonly used with adults. So when we talk about emotional regulation, we're talking about a child's ability to monitor, evaluate, and modify their emotional responses, especially considering what environment or occupation they're doing that is requiring or interfering with emotional regulation. And childhood is a key time period for emotional regulation development. Many child and adult mental health or psychological conditions are related to emotional dysregulation, such as anxiety and depression. But when we actually think about using the word dysregulation, or some people will say things like maladaptation, we really don't want to have that negative connotation where we see, oh, a child is throwing a temper tantrum, they must have emotional dysregulation or they're maladaptive. Well, for that child, that behavior is adaptive. They're throwing a temper tantrum because they know it will get them the candy or whatever they want. And so there really is no true dysregulation or maladaptation. It's more of their behavior isn't acceptable socially, or it's not conducive to the occupation we want them to be able to participate in. Broadly, when we look at mindfulness, it's important to talk about the theories because unfortunately there's not a lot of evidence on the literal mechanism of change in the body or in the brain when we look at mindfulness's impact on emotional regulation. A broad theory that you want to consider is developmental systems theory. This theory has you not only think about the environment or social interaction or neurobiology or certain body systems, but it's bringing it all together in a complex, holistic manner. There's also specific theories that we can look at when we talk about mindfulness. I would say the main one in the literature that you're going to find most commonly is that first one, where the mindfulness is focused on intention, attention, and attitude. Here's a slide just talking about some of the body systems. and other systems that are involved when we look at emotional regulation and what we're impacting in order to change or modify a child's emotional regulation. As you can see, there's a lot of different factors that are going into it. And it's important to consider the role of development when we're talking about emotional regulation. Obviously, the child's brain is developing. One of the last areas to develop is the prefrontal cortex, and we're going to be talking about that area in a little bit later. Children also develop specific skills over their lifespan. So first they might be identifying emotions, then they're learning what emotions are appropriate to display in public, and then they're working later on to build skills like empathy, which is really important for emotional regulation. Children also have bottom up and top down skills. So bottom up skills are unconscious reactions or intake of different stimuli, versus top-down skills are being able to voluntarily control emotional responses. And children are going to develop their bottom-up skills before their top-down skills. And then we also have to consider adverse childhood experiences, commonly known as ACEs, which can negatively impact children and adolescents' emotional regulation and can impact them throughout the lifespan. So when we talk about the neurobiology involved in emotional regulation, there's the autonomic nervous system, specifically the parasympathetic nervous system, that we want to consider. One specific area of research preliminary has been with the vagus nerve and how it controls things like heart rate. The main area of focus in the research has been on the central nervous system, specifically with the limbic system, which is traditionally thought of the emotion area. It has your hippocampus and your amygdala, and then the cerebral cortex, which is that higher order structure, which means it's going to control the voluntary emotional responses. There are several key areas that have been identified as neurobiological networks that control different aspects of self-regulation and emotional regulation. I'm not going to talk about the specific physical areas of the brain. I'm going to talk more general what these networks are proposed to do in theory. The ventral attention network plays a role in identifying important stimuli, reorientating attention, and filtering task relevance, along with the dorsal attention network. The salience network, if it gets overactivated, it can cause hyperactive or inappropriate responses to stimuli, and its role is to detect relevant stimuli and work with us to be able to switch tasks. The default mode network is involved in mind wandering, self-monitoring, and reflection. Deactivation of this network has been shown to result in more mind wandering, and development of the default mode network increases children's self-reflection and self-monitoring skills as they grow. The frontal parietal network is important for activity, again for switching between tasks, and also recognizing stimuli and feedback within the brain to make fast behavior adjustments in response to stimuli. Finally, we have the cingulo-operacular network, which results oftentimes in leading to anxiety disorders. When it gets overactive, children or adults feel the need to have more control in ways that are not typical. And overall, developing connections during maturation between the salience network, the frontal parietal network, and the default mode network is critical for task switching skills and limited mind wandering. Here I have two pictures of different brain areas where scientists have theorized that emotional regulation is going on. Unfortunately, there's not just one theory. There are multiple theories. You could read research articles all day and never come across the same theory or brain areas for emotional regulation. What I want you to take away from emotional regulation is that there are many brain areas and there are multiple connections across areas. It's not just one area that we're looking at. The picture that I have on the left is kind of interesting, showing the relationship between the red areas are where we're starting before emotional regulation, and then coming from the amygdala and going out, we have the response. So they have a theory about how certain areas are working to send information before we receive emotional stimuli, and then there's other areas that are then responding more to emotional stimuli. The picture on the right, we have that top section, letter A, are the areas of the brain that are activated during emotional interference. So that's like seeing a picture of someone who's sad, but then the words say that they're happy. So those are the areas of the brain that are lighting up. And then B is areas of cognitive interference. So that's like seeing a word in the color red, but the word is orange. So there's that cognitive dissonance going on. And then on letter C, we have where the areas match. So where there's both cognitive and emotional interference, and where the brain is reacting to both of those. Because it's important to consider how cognitive control and underlying emotional response that we can't control are both impacting children's emotional regulation. Unfortunately, though, both of these images are from studies with adults. There are actually no emotional regulation studies where they did scans or imaging of children's brains to try and find these emotional control areas. So again, this amygdala activation theory is that less activation of the amygdala is going to result when we have emotional regulation strategies that are thought to kind of control our emotions, whereas hyperactivity of the amygdala is going to result in out of control emotions or emotional liability. However, this study again was done in adults, so translating it to children, we can't say for sure how accurate that is. There is some studies when we talk about the mechanism, not looking at the brain, but looking more at what skills are we actually building when we talk about mindfulness. So one study theorized that when we have mindfulness, one of the skills that we're building for the mechanism of change is inhibition of emotional distractor stimuli. Another study had strong evidence that mindfulness is impacting cognitive and emotional reactivity skills, and then moderate evidence that mindfulness is building awareness, focusing on less rumination and less worry. But also, again, that study too was done in adults and not children. So for conclusion, unfortunately, the physical mechanism between emotional regulation and mindfulness as children is virtually absent across the board. We really have little to work with here, but something to consider is that the field is relatively new. The field of mindfulness really has only taken off in the 21st century, and most of our studies where we're looking at brain imaging are only within the last 10 years. And neurobiology is constantly developing. They're coming out with new theories, new imaging, new networks or emotion feedback loops on the daily. So there's a lot of development that will be continuing to happen. Now I'm going to talk about studies that actually did mindfulness interventions with children. So I found 7 studies. 6 of the studies took place in schools. The overall participant age range was 3 to 12. The studies were all very recent, and 5 of the studies took all students. It didn't matter if they had a disability or not. And then 2 studies specifically looked at ADHD and severe learning disabilities, and the programs ranged from 4 to 8 weeks. For the ADHD study, they did an intervention that was 75 minutes for 8 weeks, and it focused on things like walking and breathing meditations, body scans, and building emotional awareness. The outcome was that they found increased emotional regulation between the intervention group compared to a control group. Our learning disability study is a 2017 one-group pre-test, post-test study. They did 60-minute interventions for 8 weeks, and they did activities like mindful eating, mindful breathing, body scans, and building awareness of sensations and emotions. And they measured outcomes from the students to find decreased anxiety and depression after the intervention versus before. And then for teachers, the teachers reported less behaviors like hyperactivity and classroom disruption after the intervention was completed. Overall, this is a summary now from our last 5 studies where they took students across the board. And the studies found results like moderate increase in building mindfulness skills. So they directly measured students' ability to be mindful, and resulting in decreased social problems among students. Another study found increased pro-social behaviors and less hyperactivity after the intervention. A third study only found qualitative data that supported improved regulation. The quantitative data actually found no significant effect between the control and the intervention group, but one of the reasons might be because the quantitative data just couldn't measure a small increase. And then our fourth study found improved satisfaction in the child's psychological needs being met. And finally, a study found that emotional self-efficacy predicted children having better life satisfaction, but they actually didn't report results. And that's this study. So there was one study where it was an occupational therapy intervention done by OTs, 45 minutes a week for 4 weeks, and they included sensory principles along with mindfulness, which is interesting when you consider the two combinations and what those could provide. So they did fun activities like slime, coloring, yoga, and deep breathing. Unfortunately, they didn't actually report the results of the intervention. They only reported data that found that children who had increased self-efficacy also had higher life satisfaction. So that's a little disappointing. There's a lot of needs for further research, and I'm excited to see where OT specific research, specifically with children, can take us in the future to prove that these interventions are good for actual OT intervention and that we can improve emotional regulation and occupational therapy outcomes for our clients. When we translate this into practice, one of my studies concluded that we should have cautious enthusiasm. So we really want to consider our scope of practice. Emotional regulation does fall under two different occupation categories, and it is an underlying factor in the OTPF. And we also have self-regulation identified as a type of occupational therapy intervention. So we definitely can do it when we consider it in the context of what occupation or what underlying performance factor are we addressing to address occupational therapy outcomes in our clients. And now I have a demonstration. So I'm actually going to stop sharing really quick so I can share another tab with you. So this is an example of a mindfulness intervention that you could do with a client. This is a 2-minute this is a calm intervention mindfulness activity for children ages 6 to 8. So you can follow along. And I actually need to just share my sound really quick.
Hi, my name's Andy. So make sure you're sitting somewhere comfortably, or if you prefer, you can do this lying down. So we're just going to do a really simple exercise where you take a couple of nice big deep breaths and you just allow the body and the mind to relax and to feel a little more calm. You can close your eyes if you'd like to. So just start by taking a nice big deep breath, breathing in through the nose and out through the mouth. Now, as you do this, you might find it easier to put your hand on your tummy. And it's a bit like sort of watching a balloon rising and falling, getting bigger and getting smaller. So you take a breath in through the nose. The tummy rises, gets bigger. You breathe out through the mouth. And the tummy falls down, gets a bit smaller. Just do that a couple more times, breathing in through the nose, tummy expanding, getting bigger, breathing out through the mouth, tummy shrinking, getting smaller. And again, breathing in through the nose and out through the mouth. So just feeling that movement with your hand, just watching it rising and then falling. And then when you're ready, just opening your eyes again.
And then to wrap it up, I just have a case study in here that I can share the link to view this presentation, and you can look through that kind of just to talk about more mindfulness interventions. So overall, again, our question was, how do mindfulness-based meditation interventions affect emotional regulation in children? Unfortunately, currently the mechanism remains largely unclear, especially looking at the neurobiology. However, we are starting to see evidence of certain increases or decreases in key brain activation areas and networks, and that it's important to think about the theory that you're using behind mindfulness interventions and whether you're looking at more the top-down approach, where you're looking at voluntary control, versus bottom-up, that unconscious reaction to stimuli, and that there is limited to moderate evidence that mindfulness interventions are effective for use for emotional regulation with both our neurotypical and our neurodivergent children. Does anyone have any questions or comments? I can also pull the case study up if you'd just like to look at that too.
Any questions for Jenna? Okay.